An 80-year-old woman present with a 24 hours history of painful tender swelling under the right side of the jaw associated with a tender swelling under the tongue. The illustration shows that intraoral appearance. In order to confirm the diagnosis, which one of the following would be the most appropriate investigations? So here is the picture in which we can see a painful swelling, tender swelling under the right side of the jaw associated with a tender swelling under the tongue. Swelling is there under the tongue and right side of the jaw. And the history is very short, which is 24 hours history of painful tender swelling under the right side of the jaw associated with this tender swelling under the tongue. So how to investigate this? Options A is intraoral plane radiograph, ultrasound focus on the region below the jaw, CT of the head and neck, cyelogram of the submandibular salivary duct, MRI of the head and neck. This patient has a stone in the right submandibular duct. The tissues around the duct are reddened and swollen. The pallar area immediately to the side of the midline in the illustration is the stone at the duct orifice. The stone can sometimes be felt on bimanual palpation. The swelling under the right angle of the jaw is the enlarged and obstructed submandibular gland. The classical clinical appearance of an enlarged submandibular salivary gland, which is illustrated here. Here we can see this enlarged submandibular salivary gland. So virtually all stones that occur in the submandibular duct are radio-opaque, and the simplest and the most appropriate means of confirming the diagnosis to perform an intraoral plane radiograph. Intraoral plane radiograph, lateral oblique or preferably occlusal. So which A option is the correct answer, the A, which is to perform an intraoral plane radiograph. Here in the X-ray we can see stones in the submandibular duct. In this picture we already seen. A 61-year-old Asian man seeks advice on his risk of developing carcinoma of the prostate. He has no symptoms suggestive of blood and neck outflow obstruction. He is in a good health and does not take any medications. He stopped smoking 10 years ago with a 30-year history, and he is retired from the aniline dye industry. His father developed carcinoma of the prostate at the age of 58. Which one of the following the most important risk factor for this man? Which one of the following is the most important risk factor? We have to find out the risk factors. His ethnic origin, his age, his family history, his past history of smoking, his work in the dye industry. The carcinoma of the prostate is common, and for a man aged 50, the lifetime risk of developing microscopic disease is about 40%. The risk of clinical prostate carcinoma is 10%, and the risk of death from the disease is 3%. The disease occurs more frequently in dark skinned people and is relatively uncommon in Asians. The incidence of the disease increases with the age, and half of the cases of carcinoma of the prostate occur in men over the age of 75. Having a relative who developed the disease before the age of 60 is the most significant risk factor in this man. So option C is the correct answer. Having a relative who has developed this disease before the age of 60. Remaining, cigarette smoking is a risk factor for many disease and malignancies, for example lung and bladder, but carcinoma of the prostate is not one of them. Aniline is a benzene derivative and is used in the manufacture of rubber, dyes, pharmaceutical, and various resins. Aniline was first made from the distillation of indigo, a plant native to the West Indies and South of America. These appears to be an increased incidence of carcinoma of the bladder and urinary tract among workers in the aniline dye industry. But this may be related to the exposure to chemicals other than aniline. No relationship with prostate carcinoma and aniline dye exposure is apparent, because in aniline dye Ca will be from the on the in bladder, not in the prostate. So here this option is not correct. So option C is correct, in which it shows his family history. A 27-year-old man with a history of heroin dependent present to the emergency department with abdominal pain and vomiting. Heroin dependent young male presented with abdominal pain and vomiting. He appears agitated in mood and has a tachycardia and a fever and dilated pupils. Four things: agitated mood, tachycardia, fever, and dilated pupils. He admits recent use of cocaine and heroin. Which one of the following clinical findings is most useful in differentiating cocaine intoxication from heroin withdrawal? So the option A is agitation, B is abdominal pain and vomiting, C is tachycardia, D is dilated pupils, and E is fever. So fever is the most differentiating feature of cocaine intoxication. Fever is not present with heroin withdrawal. So fever is the correct option, correct answer. Acute cocaine intoxication is characteristics by sweating and very high body temperature, anxiety, severe agitation, panic aggression, muscle twitches, tremor, loss of coordination, heightened reflexes, abdominal pain, vomiting, tachycardia, elevated blood pressure, headache, blood vein, pallor, confusion, muscle rigidity, weak rapid pulse, and cardiac arrhythmias. Dilated pupils can be present in both cocaine intoxication and during heroin withdrawal. Withdrawal symptoms from heroin include a craving of the drug, restlessness, yawning, tears, diarrhea, low blood pressure, stomach and leg cramps, vomiting, goosebumps, and a runny nose. These withdrawal symptoms get stronger and usually peak around 2 to 4 days after last use. They also include increased irritability, insomnia, loss of appetite, elevated heart rate, muscle spasm, emotional depression. They usually subside after 6 to 7 days. So option E, fever, is the correct answer. Our next question is, which one of the following groups has the highest risk of developing iron deficiency? Which one of the following groups has the highest risk of developing an iron deficiency? Breastfed babies, toddlers,